Hey, it's Mo Egger. Summertime means warm nights on the outdoor patio at Long Neck Sports Grill. They've got 4K TVs outside, so you don't have to miss a game. Awesome wings, Northern Kentucky's best beer selection, great service, 3 terrific locations in Northern Kentucky, and maybe you could have a Long Necks in your neighborhood. Your chance is here. Go to longnecksportsgrillfranchise.com. That's longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long. Come often.
On Wednesdays, we talk injuries with one of the experts from OrthoCincy. The great thing about OrthoCincy is they have specialists and locations throughout the tri-state. They offer walk-in orthopedic urgent care weekdays 9 to 9 and Saturdays 9A to 1P. Learn more at orthocincy.com. That's orthocincy.com. Dr. Nick Early from OrthoCincy is with us. There's a lot to talk about. Let's begin with Carson Spiers. Pitched last Friday night, threw really well, struck out the first 6 guys, had 9 punch-outs, and then less than 24 hours later, he's on the injured list with a right shoulder impingement. Let's begin with that. What is an impingement?
So you can think about this like almost a pinching in his shoulder. So the way your shoulder is built is that you have your shoulder blade kind of comes up on top of your shoulder, and you have your big muscle, your deltoid on the outside of your arm there. And underneath that, there's a space. And then deep in your shoulder, surrounding kind of the ball part of the ball and socket, you have a rotator cuff tendon. And oftentimes you see this in people who are very active with any kind of overhead stuff, especially throwers. You can get impingement, where basically you get pinching of those rotator cuff tendons and the tissue that's kind of deep in the shoulder and the stuff that's kind of surrounding it. And so it's kind of a way of, phrasing an injury or a problem such that there's not a lot of structural damage, but there's just kind of an irritation. And, it can cause, some difficulty with throwing or other, strength activities that require kind of stabilization of the shoulder as you're going through the motion.
So he pitched in the game on Friday despite feeling some discomfort. Could that have made this worse?
Yeah, and definitely if he was already having some symptoms, when he pushed through and obviously, like I said, he was very effective, was throwing hard and everything. Afterward, he probably, just had an increase in his symptoms and was just noticing, okay, something doesn't feel right. But it was, not that necessarily something was really significantly damaged as much as there was probably some inflammation and, and things are just kind of more out of control from what was already going on rather than something new being injured.
So let's talk about the timeline here. The Reds are expressing optimism that this is the sort of thing that paired with the All-Star break is going to mean that he doesn't have to miss a lot of time. Does that feel realistic to you?
Yes. Yeah. Hopefully, like I said, given that he had a clean MRI, with this type of thing, a little bit of rest, some anti-inflammatories and doing physical therapy exercises to kind of get the shoulder moving and also kind of stimulate those muscles to just kind of help stabilize things. A lot of times you can turn this around pretty quickly. Now, that said, there's also the other side of the coin, which is sometimes this could be an ongoing thing where you're kind of dealing with it off and on. But hopefully it was good timing for him having a few days off there.
This news came on the heels of finding out that Graham Ashcraft has had to go on the injured list. He is dealing with an elbow strain, and this has played out in sort of a weird way. So he pitched against the Yankees back on July the 2nd, felt something, still pitched. They went to send him to Louisville, and then they rescinded that because actually, he's got an elbow strain, and so they've put him on the injured list. The initial plan is to give him a PRP injection. They've determined he's going to be out until September. I think a lot of people look at this and feel like maybe they're just delaying the inevitable and he's ultimately going to have Tommy John surgery. Is that maybe a rush to judgment that's unfair?
And it's hard to say. I would tell you that would definitely be a concern. With that, when you're talking about a strain or you're starting to see, reasons why you might do a PRP injection, you are a little bit more concerned about like structural issues. Now, it must not be to the point where it's concerning that's like, okay, he definitely needs it. Oftentimes you will try some conservative stuff with rehab and medical treatment, such as an injection first. And the reason being is because if you go the route of, okay, we're going to do, Tommy John surgery, then he's basically, out all next season, for the most part, or at least a good portion of it, potentially. And so, if you look at that, if you can resolve this, and avoid that, that's definitely, preferable. And so you'll know in a relatively short amount of time over the course of, weeks to months, with the conservative treatment, if you're looking like you're going to get some improvement, and if not, you may have lost some time there towards the inevitable surgery. But if you go that route, you're definitely missing a significant amount of time.
Can you walk through exactly what the PRP injection does?
Yeah, so PRP stands for platelet-rich plasma. Basically, what you do is you take some blood from the patient. You actually then spin it in this large machine that kind of separates the components of the blood. And in your blood, you have part of the blood is called plasma, and part of the plasma that has platelets in it. The platelets are, part of the blood that kind of produce a lot of growth factors. They do a few things. They're involved with clotting, but they produce a lot of growth factors that can actually aid in healing. And so out of that volume of blood, you actually then inject a small volume of the plasma with the platelets in it into an area where there's damage. And we do this for a lot of different things. And this can actually induce healing and really help, with some of these types of conditions.
All right, we have another Red to talk about. Nick Martini recently had thumb surgery. They're holding out hope that he can maybe still play at some point in late September. Based on what we know about the strain, it's the UCL of the thumb. Does it seem realistic that he could actually come back and help this team this year?
Yeah, potentially. It kind of depends exactly on the degree of injury. A lot of times, you will need some time for healing after a surgery like that. For the most part, it's just a matter of kind of letting things kind of scar down and heal after the surgery. And then the rehab is not, too crazy. You can get your motion back pretty quickly, and it's more about kind of supporting it. So if he heals up well, potentially towards the end of the season, it still might be difficult just because he'll need at least a period of time there for healing afterward before he can, grip a bat really hard or do anything like that. Like there's going to be some period of time where you have to avoid stress on it. But once that period of time is over, then you kind of start ramping things up and hopefully, get him back. But, the timing of that will be somewhat in question.
You watch enough baseball, you see a lot of guys, maybe Ellie De La Cruz most notably. I actually see a lot of kids rocking this, and I think they do it for cosmetic reasons more than anything else. But they wear, when they get on base, what looks like an oven mitt, and that's kind of what it's called, the protective oven mitt that's become so popular. Would you recommend that if you're a base runner, you put that on to avoid something like this?
Yeah, honestly, I think in today's, game where there's many head first slides as you're seeing and everything, there's no harm in doing it. Like you said, it looks cool too. So there's that. But yeah, I mean, I don't see a downside, really. I don't think it would be a problem. And yeah, these little injuries that happen to the hands and stuff, it's a shame when it happens because you go, oh, it's just a freak thing. And if you could avoid that, then hey, yeah, put it on.
Dr. Nick Early from OrthoCincy is with us. One more Red. Luke Maile is dealing with a herniated disc. They are also holding out hope that he'll be able to come back sooner rather than later. Let's start with the injury. What is a herniated disc?
So you have these discs in between the bones in your spine. Okay, they're called intervertebral discs, and they're kind of squishy. The outside is a more firm part, and the inside is a little bit squishier. And what can happen is you can get like a little herniation or like a little weakness in the outside part that's a little bit more firm, and the squishy inside part can kind of push out. And we call that a herniation. And it can push on nerves. It can push on things that can kind of cause pain. It's actually very common for people to have herniated discs. Sometimes they're very symptomatic and cause a lot of pain and push on a nerve, and it makes somebody really miserable. And sometimes it's not too bad. As we age, our discs become less healthy. So if you were to look at like an x-ray of an 80-year-old person's spine, it would look very different than a 16-year-old spine in terms of their disc spaces and just the way things look. So naturally, you'll get some damage to those discs over time. But you can actually have kind of a traumatic herniation too, where let's say it's a person with a young, healthy spine and they twist or do something a bad way, and it kind of pushes out some of that disc material, and it can push on the nerve and cause potential problems.
So he got an injection. That was the initial treatment. Is that going to be sufficient? Do we feel like it's realistic to expect that Luke comes back sometime soon?
Yeah, kind of going back to some of the other stuff, the first thing you do for herniated disc is conservative treatments. You're looking at like medications, physical therapy stuff, and then oftentimes an injection. That injection is usually a steroid injection around the area of the disc. and you're kind of around the area where the nerves are, trying to decrease the swelling in the area of the disc and the nerve, trying to decrease the symptoms that somebody's experiencing.
The position that he plays make him more susceptible to dealing with this again?
Potentially, just all the, squatting and standing up and everything like that. But like I said, honestly, this can happen, to people in everyday, occupations and everything as well. But, I don't specifically know of anything I would say, like, a catcher would be more likely to have it, but, their bodies get beat up. So it wouldn't surprise me if there's some reason why that would contribute.
No question. One more. It's an FC Cincinnati favorite. Nick Hagglund had ankle ligament damage and so had ankle ligament reconstructive surgery. That's very, very verbose, I guess. That sounds complex. What's involved?
So, yeah, it is a complex issue. And depending on what's going on, oftentimes what this is from recurrent sprains, like multiple injuries to the ankle where you have damage to the ligaments, and they kind of heal. They either don't heal well or they heal kind of stretched out, and so that there's this kind of chronic instability of the ankle. And somebody will experience, kind of recurrent sprains, pain. They'll have popping in their ankle. They'll have all sorts of different symptoms. They'll get swelling, and it's a problem. So once it comes to surgery, you're looking at either repairing some of those ligaments by tightening them up, and also oftentimes augmenting those, either with some kind of surgical device which can help with that, or potentially even using like cadaver tendon to reconstruct some of the ligaments. And there's different techniques for that, and it can be pretty complicated. But most of the time, actually, people do fairly well.
Hagglund is 31 years old. I know he wants to resume his career next season, 2025. Do we feel like that's a realistic possibility, or could this be the sort of thing that threatens at least the beginning of next year?
I would say it kind of depends on how his rehab goes. There's a hope that, he would be able to make it back. I would say, the older you get, the harder it is to rebound from these types of things. With that said, looking at his ankle health overall, like if this is one of those things where he doesn't have a lot of other stuff going on, there's not a lot of damage to cartilage, or he's not getting any arthritis in the ankle or anything like that. If you look at the, how people tend to do after these reconstructive, ligament surgeries, in general, they do fairly well. Now, getting back to an occupation like being a professional soccer player, though, is a completely different, level of how you're going to do. So it's always difficult to get back after something like that to your pre-injury level of performance, especially as you continue to age. But I think it's realistic to hope, at least, to say, okay, there's a chance here that he can get back and perform well and be able to get on the field and do what he needs to do.
We've been doing these segments for a couple of years now. I think we've set the record with 5 injuries. Awesome insight as always. I appreciate the time, man. Thanks so much.
Of course. Yeah, thanks a lot.
There you go. Dr. Nick Early from OrthoCincy. We say this all the time. The great thing about the people at OrthoCincy is specialists and locations across the tri-state. This includes walk-in. Walk-in means you do not need an appointment. Walk-in orthopedic urgent care. Weekdays 9A to 9P. Saturdays 9A to 1P in both Edgewood and Anderson. It's easier and it's definitely cheaper than going to an ER whenever you have an urgent orthopedic injury. And remember, when my daughter broke her foot, what we did? Went to OrthoCincy. You do the same. OrthoCincy.com. That's OrthoCincy.com.
Hey, it's Mo Egger. Summertime means warm nights on the outdoor patio at Long Neck Sports Grill. They've got 4K TVs outside, so you don't have to miss a game. Awesome wings, Northern Kentucky's best beer selection, great service, 3 terrific locations in Northern Kentucky, and maybe you could have a Long Necks in your neighborhood. Your chance is here. Go to longnecksportsgrillfranchise.com. That's longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long. Come often.